One of the most inspiring quotes that I've come across in my life is by Bishop Desmond Tutu, an inspiring figure who was awarded the Nobel Peace Prize in 1984 for his role in the opposition of apartheid in South Africa. Now, in referring to the negative consequences caused by this discriminatory system of apartheid, he said this: "There comes a point where we need to just stop pulling people out of the river. We need to go upstream and find out why they are falling in." Essentially, what he was suggesting was that instead of pulling all our efforts together into putting out the fires, perhaps the wiser thing to do is to find out why the fires were started in the first place and what could have been done to prevent it from happening. Now, this rings true to the common phrase we often hear in medicine, which is prevention is better than cure. Now, of course, it's good to have well-trained healthcare professionals, advanced healthcare facilities, affordable and excellent healthcare. But perhaps it's even better to have individuals that will take responsibility of their own health. Individuals who are aware of what measures to take in order to stay healthy, rather than only seeking for treatment when they fall sick. Now, let's take an example that is close to home. Malaysia currently has the highest rate of obesity and overweight in Asia. Now, in 2019, the National Health Morbidity Survey in Malaysia observed that 50.1% of adults are overweight or obese. Now, this figure has steadily increased for the past decade. The survey done in 2019 also revealed that 25.1% of adults are physically inactive. Now, we understand that obesity is complex and it's a preventable disease due to multiple factors such as genetic, behavioral, socioeconomic, and environmental. But fundamentally, it is a result of an imbalance between the consumption and the expenditure of calories, thus resulting in a surplus of energy, which in turn leads to an excess of body weight. Now, while environmental factors are likely to be the main factors in accelerating the rise of obesity, it is clear that high caloric consumption and inadequate physical activity are likely to be the main drivers or contributors to obesity. Now, the physical activity guidelines for America categorizes levels of physical activity into inactive, insufficiently active, active, and highly active. Now, an adequate amount is considered to be around 150 minutes to 300 minutes of moderately intense physical activity a week. Now, moderately intense physical activities include things like brisk walking or mopping the floor, vacuuming, or raking the yard. Now, as brisk walking is considered as a form of physical activity that is moderately intense, measuring the daily steps of an individual using smartphones or wearables can determine the level of physical activity we perform daily. A research showed that when individuals who are having a low level of physical activity of, let's say, less than 5,000 steps per day, increase their physical activity to more than 10,000 steps a day, it showed that they actually decrease their body weight, BMI, weight circumference, and body fat percentage. They also showed a reduction in negative mood such as anxiety, depression, and anger. Of course, this was a study that was done over a period of 12 weeks. Now, other studies have found a range of benefits from walking 10,000 steps a day. This is for young to even older adults. And these findings include the reduction of blood pressure, body composition, and lipid profiles. Of course, the rate that is suggested for these 10,000 steps a day of walking, it's roughly around 100 steps or more per minute. And we know that further evidence suggests that reinforcing such intervention with rewards can be effective in increasing physical activity levels in a community interventions for weight management must also take into consideration calorie intake of an individual because of its role in energy levels or energy balance. A study on the dietary intakes of obesity among Malaysian adults reported that while calorie intake did not exceed the recommended value of calories, but however, the intake of sugars and fats was significantly high among participants. The study also observed that Malaysians had an inadequate intake of fruits and vegetables, whereas protein consumption was higher than recommended. So this kind of habitual dietary lifestyle can potentially continue to contribute to the rising prevalence of overweight and obesity in Malaysia. Now, recent research done in among private office workers were conducted in Selangor, Malaysia, to study the motivators and also barriers of physical activity. Participants involved in office work or white-collar work, aged 18 to 55-year-old, were recruited from small to medium-sized enterprises, and a low level of physical activity was actually observed among these private workers. And what are some of the main barriers causing them to have this low level of physical activities? Now, these included exhaustion from work, laziness, lack of discipline, family commitment, and of course, the unfavorable weather, raining and the hot weather that we have outside most of the time. The main motivation factors included, of course, physical condition, how fit the person is, the person's stamina, psychological condition, how confident a person is, and mastery, how good a person is in an exercise or in a sport. Now, it was observed that private workers with higher motivation engage in more physical activity, while those who perceive more barriers engage in less physical activity. Now, we understand that adequate physical activity not only improves the overall health of an individual, it also plays a significant role in achieving and maintaining optimal weight. But the big question is, how do we get people to be more physically active? With further advancement and acceptance of wearable devices or health wearables are expected to be widely adopted at organization and community levels. And recent development in software and algorithms have enabled smartphones and wearables to possess an ability to capture health-related data with greater depth and also greater range. In 2020, the Health Promotion Board of Singapore actually collaborated with Apple to develop a healthcare app called LumiHealth to promote physical activity, nutrition, screening, and mental wellness. It's an app that encourages Singapore citizens to stay active, make healthier food choices, practice mindfulness, sleep better, and there is even an incentive of up to 380 Sing dollars in the quest for better health. Basically, the user receives weekly activity goals, wellness challenges, and nudges that cover nutrition, sleep, mental well-being, and more, tailored towards your health goals and also your Apple Watch activity. Now, the emergence of wearables has allowed people to engage in health-related behaviors and practices that are based on habits rather than events. User-centric health prevention activities are also preferred by many as methods of management has become increasingly diverse. In 2018, Malaysian Communications and Multimedia Commission recorded a total of 78% smartphone users in Malaysia. Now, smartphones are primary phone devices that can perform internet-based services and run applications of third-party developers. Now, statistics show that there is actually a rising trend in smartphone usage And this suggests that health intervention through wearable devices or smartphones can be performed in majority of the population due to its wide usage. And intervention through these wearables or smartphones are also cost-effective and convenient, as it utilizes a device that is already available by many or to many. The rising trend of obesity in Malaysia is alarming, and we understand its significant association with increasing rates of morbidity and mortality. Workers are also forced to lead an increasingly sedentary lifestyle due to environmental and cultural shifts. Physical inactivity can contribute to overweight and obesity, which in turn predisposes an individual to non-communicable diseases such as diabetes and cardiovascular diseases. Now let's also consider how the COVID-19 pandemic has significantly affected the obesity epidemic globally. The first human cases of COVID-19 were initially reported on December 2019, and by the end of 2020, approximately 80 million cases were recorded, with 1.7 million deaths recorded worldwide. Now, it is likely that these figures were underreported due to limited testing and surveillance by many healthcare systems. Now, in addition to the loss of lives, the labor market has also been significantly impacted during the COVID-19 pandemic on a massive scale, and this has driven income of many countries to stagnation or decline. Now, labor income is estimated to have declined up to almost 10% in the Asia-Pacific region due to in the first 3 quarters of 2020, and countries with data of labor markets actually show a greater decline in work hours relative to decline in employment. And the COVID-19 crisis has not only resulted in a health crisis, but also in an economic crisis worldwide. Now, with countries at the bottom of the income distribution having a higher risk of increased mortality and unemployment rates. Now, given the strong association between the risk of obesity and their socio-economic status, an economic crisis could potentially accelerate the growth of obesity in groups of lower socio-economic status. Additionally, it is evident that obesity increases the risk of severity and mortality in individuals infected with COVID-19, and preventive measures used to reduce the spread of COVID-19, like lockdowns and movement control order, have actually worsened the obesity epidemic. Now, what can we actually do to mitigate this negative impact obesity has on our lives? The truth is, a lot needs to be done, a lot can be done. And this is just one of the many diseases among us today. My goal today is not to make you buy an Apple Watch or Fitbit or Garmin watch. I'm just giving you one of the many examples of how we can improve the health and lives of individuals worldwide. Evidently, the rise of wearables and smartphone usage has opened up the possibility of introducing interventions that can promote healthy behavior. And although this form of intervention is still novel, there is a growing body of evidence to suggest the role of digital intervention in promoting healthy behavior through wearables and smartphones. Now, I'll come a close with a quote by Robert Pattinson in Christopher Nolan's movie Tenet. I won't review any spoilers for those who haven't watched the movie yet, but anyway, at the end of the movie, Neil, the character played by Robert Pattinson, says this: "We're the people saving the world from what might have been. The world will never know what could happen, and even if they did, they wouldn't care. Because no one cares about the bomb that didn't go off, only the one that did. It's necessary and important to fix what is broken, to provide treatment for the sick, and to engage in disaster control. But might I suggest that instead of us just focusing on solutions to existing problems, let us also focus our efforts on prevention rather than cure. And let us harness the power of technology and together create a sustainable future with better health for everyone, everywhere.